The healthcare industry has given out awards this week to patients and caregivers, as well as a support group. SingHealth says all 37 of the award winners are inspirational partners. Well, two of the winners, a caregiver mother and a doctor who started a support group for young adult cancer patients. Well, they join us now live on this program. I'll start with you, Dr. Poon. If you could very quickly explain what these awards are for both yourself and Ms. Sit, and also explain you started your support group for adolescent and young adult oncology. That's what it's called. Presumably because young adults require different kinds of support. So first, tell us what these awards are, and two, if you could explain why your support group is different from other existing groups.
Hi, thank you. Thanks for having me tonight. So first of all, I think the awards were actually given out by SingHealth, and the whole idea is actually to honor and basically award patients who have been actually very inspirational in their journey as patients. And on top of that, also to actually give recognition to the caregivers, to the patients who are very oftentimes neglected, because without their support, the patients obviously will not be able to thrive as well. In the recent years as well, they've also started giving out awards for support groups for various other allied health as well, that actually have given additional support to patients. So what happened is that Adolescents and Young Adults Oncology essentially refers to a group of patients with cancer between the ages of 16 to 45 years old. And really, they are a group of patients who are trying to actually get on with life and trying to perhaps embark on a new career, just finishing school, but yet they are dealt with a diagnosis of cancer. So clearly, it's like an identity theft whereby, they are robbed of their entire whole life ahead of them almost. And what we really wanted to do was to try and return that voice to them and try to bring back some normalcy to them, and trying to create a safe space, if I may use that word, whereby they can feel like they are not stigmatized against, they're not isolated, and they can be themselves. So this was really the whole idea behind the support group.
Okay, I'll get to Ms. Sit in a second, but I'll very quickly follow up on that, Dr. Poon. Now, you say this group, 16 to 45, so there are people who are, in some cases, starting out in life, in some cases, trying to stay on in their careers. You feel that should they get cancer, they feel particularly isolated and not part of the existing society. What kind of support can you offer a young person who has cancer, who is uncertain of what lies ahead, and still must pretend life will go on because he or she might live?
Well, I think first up, definitely life will go on. It's a matter of how to get them to live well through a diagnosis of cancer, and not just during the period of having cancer. Because really, after a diagnosis of cancer, they actually go on to lead their life, and hopefully they all survive. And when they survive, they go into survivorship. There's a whole host of other problems that they actually have to deal with. So to be very honest, I mean, the support group, what it first of all tries to do is to normalize the whole process and remind them very much that they are still themselves. They are not any different. It's just that they happen to have a diagnosis of cancer. And on top of that, to try and help work through the various psychosocial distresses that may come along, and some of the other pertinent issues that happen during this period, during this phase of life. For example, reintegrating back into society, or getting ahead with their education again, and issues such as fertility preservation and post-traumatic stress disorders, even after a diagnosis of cancer. These are just some of the issues that plague this age group.
Okay, let's get Ms. Sit in on this right now. As Dr. Poon mentioned, the awards were given out to honor patients, support groups such as her own, and caregivers like yourself. Dr. Poon supports 16 to 45-year-olds. The person you cared for is much younger than that, and it describes you here as a caregiver mum, which I think vastly underestimates what you have done as a mother caring for a very sick young child.
Yeah, so my son Damien was diagnosed with leukemia when he was 23 months old, back in 2018. So I was his primary caregiver, and we spent a lot of time in the hospital over the next 2 years during his treatment. And we also spent a lot of time at home as I was the main caregiver. So we did a lot of home activities, and we had to keep him away from other children. We had minimum social interactions as well, because for children undergoing cancer treatment, their immunity is very low. So we wanted to make sure that he was in the best of health for his treatment, and hence we stayed away. We isolated ourselves so that we can make sure that we don't pass on any germs to him, so that his treatment can proceed smoothly. During this 2-year period, during his treatment, the hospital became our community. It was like our second home. So we got to know people in the hospital. We also got to know other caregivers. And I think for me, it was, I took respite, sometimes even just interacting with other caregivers, just being able to talk to them about how we feel, the experiences that we're going through, the journey. And it helped me a lot as a caregiver.
Oh, thanks so much for all that.
So I think...
Just very quickly, just one more sentence, missed it.
Yeah, so I think overall, caring for a young kid, I mean, we had our own challenges, but I think we also had a lot of support from other groups, as well as from the hospital community.
Oh, thanks so much for all that. Rebecca Sit, mother and inspirational caregiver, and Dr. Eileen Poon from the National Cancer Centre. Congratulations on your awards.